Hi, I'm Piper, and we're going to go over your 6-month post-op visit today. First, what I want to know is, how are you doing? You should be feeling pretty well at this point in your journey, but I want to know if you're having any problems with difficulty swallowing, painful swallowing, food or fluid intake. Are you having any nausea, vomiting, diarrhea, constipation, belly pain? All of those symptoms are important to keep an eye on. If you are having those symptoms and you're concerned about those, we need to look further into why those may be. Go back to the basics. When you're eating, make sure you're taking your time. You're taking small bites, and the foods that you eat are not too dry. It's okay to sip if you need to while you're eating your meals. And make sure you're making the right food intake choices. Sometimes lactose isn't tolerated well after surgery, so keep that in mind as you're eating and drinking fluids and foods. Keep a journal of your intake and any symptoms that you're having so that we can figure out if there's a correlation between what you're eating and drinking or how you're doing it and symptoms that you may be having. Sleep is an important part of your journey as well. Evaluate how you're doing. Are you falling asleep right away? That's important. Get rid of distractions at nighttime. Make sure that you allow your body time to rest and recoup and regenerate in the night so that you can continue to do well on your journey to weight loss. How are you doing with your vitamins and your supplements? You ought to be taking them daily. It's okay to miss here and there because that's going to happen, but try to do your best to take your vitamins and supplements as directed. We'll check your vitamin levels at this visit as part of your routine at your 6-month post-op. Your exercise routine should include HIIT training and resistance training. HIIT training is high-intensity interval training. You ought to get short of breath, and it ought to be difficult to talk during your exercise. That's a good spot to be, to know that you're pushing yourself and you're making good progress with your exercise. Resistance training is also an important part of what you're doing to help maintain muscle mass and also to build to tone and firm as you go through your journey. Check your water intake and make sure you're getting plenty of water daily. If old habits are sneaking in, those empty calories that we drink, the sugary drinks, replace those with water and go back to the basics. Getting good protein daily, a good healthy meat, getting good vegetables. The fewer carb vegetables, the better. And then fruits will be an important part of your intake as well. The best fruits to eat are the lower glycemic index fruits like berries. At this visit, if you've had a gastric bypass or a duodenal switch, it's important to check your gallbladder if you still have it. We want to make sure you don't have stones or sludge. If you do have those and you're symptomatic, you might need to have your gallbladder removed. How are you responding to stressors in life? That's an important aspect of this process that needs to be addressed. If you find yourself eating in response to feeling stressed or anxious, be mindful of those things. Watch yourself, check yourself, reevaluate where you are and where you want to be. If you're struggling with coping skills, here are some healthy suggestions. Go for a walk instead of going to the kitchen to get a snack. Get outside, take some deep breaths, do something that's healthy to replace that old habit that may be preventing you from making progress that you want to make with your weight loss. One thing to watch for as you're making progress is inches lost. Frequently, when those plateaus happen with weight loss, people notice that they're losing inches and their clothes are fitting them better. So keep that in mind as you go. Let that be an encouragement to you. Don't think you're a failure or that you won't get to your goal just because your weight loss progress has slowed down. That's normal. Can't stress enough. That's normal. It's going to happen. Let it happen. Embrace it. Reevaluate. Make some changes and expect continued success. You'll get there. Give yourself 1.5 to 2 years to get there. It is just a process, and it's normal to struggle with it if you are. If you're not struggling with it, if you're feeling great about your progress and continuing to make it, that's fantastic. That's what we want. But frequently, it's a struggle. And know that that's normal and expected and work your way through it. Take it one day at a time. You can get there. It's going to be a matter of making the right choices and every day dying to those selfish desires that we have, those old habits, and forming new ones as you go.